Hello and welcome back to Proactive New York. I'm Christine Corrado. With me right now is Nader Pourhassan, CEO at CytoDyn, and Dr. Bruce Pattersen, Diagnostic Advisor to CytoDyn. Great to have you both. How are you both?
Thank you. Great.
We're talking today about blood work that you've received back from New York patients treated with leronlimab. Dr. Pattersen, I'll start with you. What did that blood work say?
You know, it's very interesting, Christine, because about 2 months ago, we were the first to identify this immunologic chaos that is now coming out in the lay press. And at that time, felt that leronlimab was the perfect drug for restoring immunologic normalcy, if you will. And in fact, in the patient samples we ran here at IncellDX, we saw just that. We saw restoration of the CD8 T lymphocytes, which are severely depressed in these patients, making them, many of the severe patients, immunosuppressed. That's being restored to normal, as well as quieting the cytokine storm where levels of IL-6 go down 100-fold or more. And the other thing that we're finding out is this isn't just an IL-6 disease. There are other markers in the lung that are as high as I've ever seen them in 30 years of pathology. And those are being restored back to normal levels. So we're seeing everything that we predicted 2 months ago. We're very excited about that. And the fact that patients are leaving the hospital is the most gratifying of all.
So these that you're talking about, have they been removed from ventilators at this point?
So the patients, the two that was released, they were on oxygen and they got released. There was another one on ventilator and same site got off of the ventilator. But you know, what I wanted to say is Dr. Bruce Pattersen is a former Stanford University professor, CCR5 expert for 25 years, publishing all these papers. For so long, he kept telling us this will have impact on the cancer. Well, thank God I listened to him, but a lot of people were not. And now we see the result being very beautiful in cancer. Now coming to coronavirus, he kept saying cytokine storm is what we have, we can impact. Dr. Jalal Azari, who's always done all the trials for Gilead and everybody, look at the data that Bruce sent, and he called me. He said, do you see how valuable Dr. Patterson the result is right now? He said, I am reaching out to Anthony Fauci as soon as possible and the FDA myself, because these results are, there's no joke here now. This is something that has been very, very carefully analyzed. These patients show immunological benefit. They show cytokine storm reduction. And we just want to be able to have somebody look at the data immediately in the government and get moving. And we sent the data for that matter to FDA this morning.
We'll talk more about that in just a minute. I just want to get to these additional patients that were treated in Southern California hospitals. Can you kind of walk me through how their symptoms improved?
2 patients on the press release we talk about, they were on oxygen, they were mild to moderate, they were discharged from the hospital. The other one was in ventilator, is off in ventilator. There's another one in California that we didn't talk about in press release that Dr. Bruce Pattersen actually told the patients to get her mother on leronlimab. And when they did that, that patient is feeling very good. And I'll let Dr. Pattersen perhaps talk about that patient who sent him a text and thank him for saving her mother's life. Dr. Pattersen, could you please?
It's even more amazing than that. Beyond ventilators, there's heart-lung bypass machines, which are basically life support that oxygenate the blood. And this patient was on the heart-lung bypass machine as well as a ventilator. And after 3 days of leronlimab, came off the heart-lung bypass machine and is now being weaned off the ventilator. So it's just an incredible story. This was in San Jose, California, and this is the most exciting story we've seen out of all these patients.
So Nader, as you kind of alluded to this, what are kind of the next steps here with all this great data? Can you submit this to the FDA? And you mentioned possibly talking to Dr. Anthony Fauci.
Well, Dr. Jalal Azari, one of the principal investigators, is reaching out to just show the data because Dr. Anthony Fauci, Sanjay Gupta, they all want data and they don't want to talk about how good we can do maybe. And now we have human data. So we're reaching out saying if we're going to move from CytoDyn side, we need to have manufacturing taken care of. We got 40,000 vials, 20,000 doses. This could be given to a lot of people and stop this madness of people dying perhaps, and we are going and getting hospitalized. If that's the case, if the data convinces them, we need to move fast, and we are moving as quickly as we can right now.
And just a quick update on that enrollment for your phase 2B trial to treat severe coronavirus patients. Have you begun enrolling that?
That's correct. We have. Now, keep in mind, when you do an enrollment, it takes about at least 6 weeks to get the IRB and all of the other stuff ready, consent form and the pharmaceutical manual. I mean, the list of things that we're doing is incredible. And when people ask me, why are you late a few days on your BLA? Because we're trying to save people's life right now. And the BLA is going to be filed this month, just for everybody's information.
Lots going on, and definitely really appreciate this great work that you're both doing here. Thank you both so much, and stay safe.
I appreciate it. Thank you.
Thank you.